Concern over food safety again following a possible case of hepatitis A found in a worker at a popular Chinese restaurant. Officials say the patient worked at Wah Kung restaurant in Mapunapuna from December 1st to January 6th. Now, so far, no one else has gotten sick, but health officials want to let people know just in case. Now, we're talking about hepatitis A again. Of course, it was big news back a few months ago, maybe even a year ago now, when Genki went through their scare. Benjamin Roney, family physician from Castle Health Clinic of Laie, is here to break down everything you need to know about hepatitis A. Good morning.
Good morning.
Thank you for being here.
Thanks for having me.
Okay, so for those who don't know, what exactly is hepatitis A?
Hepatitis A is a virus that infects your liver, and it breaks down your liver, and most of the time you'll get over on your own, but people who are older, people who have underlying liver damage, other liver problems, can actually end up dying. Wow.
And how is it different from other hepatitis?
So there's various forms of hepatitis. You have hepatitis A, B, C. They're transmitted different ways. For example, hepatitis C is more bloodborne, whereas hepatitis A is typically passed in a fecal-oral transmission. So either you eat something that someone else who hadn't washed their hands had touched, or you eat uncooked fish, food, anything else that has been in unclean water or conditions.
Okay, so that's how it's transferred then. So where does this originate from?
So it's something that you have in all countries around the world.
Okay.
And in America, because we've been doing vaccinations, really in Hawaii since '99, our rates are very low. But as you have lots of people coming in from overseas, tourists who visit Hawaii, they have much higher rates of hepatitis. They can bring it with them. And you don't always know that you have it necessarily. You have about 2 weeks after you're infected before you even have symptoms.
Okay, wow. And what then would those symptoms be? How would you know?
You have nausea, abdominal pain. After a while, you have dark urine. You have kind of clay-colored stools, general fever and fatigue.
Okay, and is that something that you would have to then go into the doctor for them to test you?
Yeah,
that you have?
absolutely.
Okay.
You can't really tell the different forms of hepatitis apart from a lot of other liver diseases, but with some blood tests. And that's something you have to really go to the doctor to have taken care of.
Okay, and prevention, how do we prevent getting this?
Vaccines. So vaccination is very, very important. And we've seen the rates in Hawaii drop dramatically after we started doing vaccinations. But the important thing on the day-to-day is hand washing, properly cooking and cleaning food, and just making sure that we don't eat anything that we wouldn't want to.
Right. Okay, so for the vaccination then, what do you, well, I guess, but even after, well, first let's talk, where can you get a vaccination?
So you can get a vaccination, well, if you want to, we have our information. It'll be on the screen for Adventist Health Castle. You can call us or look at our website. But it's something that little kids get when they're a year old. So starting, like I said, earlier in this, I guess it was 99 in Hawaii, but 2006 in a lot of the rest of the country, children have been vaccinated, but adults haven't. So unless you either got a vaccination last time, or you work with food, or you were a healthcare worker who needed to have a vaccination, you haven't had it, and so that's when you need to contact your healthcare provider. Okay,
so that's for prevention. But if you are having, some of the symptoms, if you think you have it, what should you do?
Go ahead and go to your doctor. Like I said, we can perform tests to find out if you actually have hepatitis or any other number of liver diseases that would kind of cause the same symptoms.
Okay, but main message is really everybody should be vaccinated because, as we've seen, it'll be at restaurants that you regularly go to. If the worker has it, it can be so easily transmitted. So just protect yourself and make sure they get the vaccination. And you have to get 2, correct?
Correct.
Okay. 1 and then a follow-up.
Absolutely.
Okay, wonderful. Well, thank you so much for joining us. Happy to have you, and great tips to know, especially, when this is such a hot topic right now.
Yep.